Welcome, everybody. I want to welcome you to this session of our Digital Summit. As you know, our Digital Summit is a series of webinars to celebrate National Midwifery Week. This particular webinar is to highlight our DNP program and some of our midwife graduates who have graduated from our DNP program over the last several years. Our DNP program has now been up and running since 2010. And we've had many midwives come through the program. And so tonight we're going to talk to you a little bit about what kind of work the DNP has enabled or how it has enhanced the practice of these particular midwives. The person who will be moderating the session is Dr. Deborah Parsonitz. She is the director of the DNP program. And at this point, I will turn it over to Dr. Parsonitz.
Thank you, Dr. Stone. I'm really excited about being moderator for this session tonight because not only do I strongly believe in the DNP degree and its ability to bring advanced practice nurses to the forefront in leadership, and I see this as such a strong place for midwives to be in the forefront of quality improvement and beginning wonderful programs as we encourage more midwives to get this degree, but also to be recognized in our state, in the U.S. and internationally as well. It also gives me great pleasure to be moderating this session because I've personally been involved with each and every one of these graduates and have seen them go through the program and grow stronger. And one of my favorite things is watching somebody come into the program and not see themselves as a leader and leave strong and as a strong leader and have a passion to go forth and just change policy and change practice. So I'll get started by introducing one of our first doctors. And I'm going to start with Dr. Julie Paul, and I've gotten to know Julie Paul well through the program, and she has some very exciting things to talk to us about. Julie, would you introduce yourself and then tell us about your experiences?
Sure, thanks, Debbie. So I am Dr. Julie Paul. I was in DNP class 4 and also a midwifery student CNEP class 42, so I'm dating myself because I think we're up to class 155. But since leaving Frontier, I am now the co-director of the midwifery program at South Shore Hospital. So why did I go for my DNP? Well, when I was sitting at staff meetings, the department meetings, and they kept saying, we have such a high C-section rate, or we have such a strong dissatisfaction with our triage service, I'm like, midwifery can do something about that. And I'm like, but how do I do that? And so I really looked to Frontier for the program because I was excited that they had a DNP program and I wanted to make a difference. So I applied for the DNP program, got in. My initial goal was to start a laborers program, but they said, you cannot save the world. You got to start with one project at a time. So I decided to do midwives and triage. And while I won't go into big detail about it, I put a midwife in triage and compared it. So a designated midwife in triage 40 hours a week, and I did that for a month. And I compared it to 2 weeks of usual care. And what I was able to turn out was that we had an increase in satisfaction with care, as well as a decrease in length of stay. And so I used those results to create, or as a stepping stone to a laborers program. Once I did my DNP project, I did leave South Shore Hospital for a short period of time. I actually went to Frontier and became a course coordinator for the antenatal program at Frontier. So I left, but in the meantime, I kept giving my published results and my data to the new chief of OB at South Shore Hospital. And that was a stepping stone. They were creating a program. They weren't sure if they were going to use PAs, nurse practitioners, or nurse midwives. Well, they decided to go with nurse midwives based on the results. And I kept pushing. I'm like, we really need midwives in the hospital. And we were at risk of losing midwifery at South Shore Hospital. So my persistence paid off. And we've since created a hospitalist program for midwives at South Shore Hospital. We are now going into our 4th year, and it is thriving. We've actually doubled the amount of midwifery patients. So we started off with 40 when we first started the program, and now we're doing anywhere from 60 to 80 patients a month. We're also first assisting. We're helping in a big way. So once we started the laborers program, I really wanted to make a presence for midwifery at the hospital. So I'm like, how can I use my degree to further my agenda of getting more access to midwifery at South Shore Hospital? So the new problem at the hospital identified was we had a high C-section rate. It was 32%, upwards of 38%. And I'm like, this is unacceptable. How can midwifery make a difference? Well, we were in the process of designing a new unit. And so I'm like, I want a space for a birth center. They're like, no. So they agreed to give me a room at the time for an early labor lounge. I'm like, okay. So I began doing some research and found out there are no early labor lounges in the country. I'm like, well, how can we just have, I can't just have a room. What's it going to do? So I really wanted to investigate how can we make a difference, go to the literature. So that's one of the tools that I learned in the DNP program. You have to do an extensive lit review. What's out there? What we found was delaying admission to the birthing unit, in theory, will help lower the C-section rate. So I'm like, okay, so how can we use this early labor lounge to deter women from getting admitted too soon? So I came up with my PICO statement. I did the whole process that I learned throughout my DNP program, and I put a proposal together. And lo and behold, it was accepted. And so we went through, this was a year-long process, so it did not happen overnight. But I created a committee that was interprofessional, included the director, nursing, other midwives, nursing, dietary, housekeeping. So we got everybody to the table and like, what can we do to design this program? So we actually created a space that highlights what women can do to lower their anxiety, get them to work in teams with their partners, and hopefully bring them together to either hopefully go home or admit them when they're in active labor. So with these tools, we did create the space, and we are the first early labor lounge in the United States. I have presented at ACNM a workshop that has actually created more early labor lounges. I have people contacting me to create labor lounges in their hospital spaces or utilizing underutilized spaces. So it's really exciting that you can make a difference just by coming up with an idea and then working through the process. The degree has been invaluable to me in giving me the tools and the confidence to be able to go to administration with an idea and be able to use the tools and sound intelligent and get other people on board to follow, including other institutions. It also was a springboard to joining ACNM's National Collaborative for the Reducing Primary Cesarean Task Force. So I actually wrote a letter to get our hospital invited into that program, and we were accepted. And so for the past year, we have been sharing our ideas and helping to lower our C-section rate. We've actually dropped it from 32% down to at times 24%. So we've had a huge impact. The midwifery program is growing. We started out with 6. We are now at 14. We have a lot of interest in our program. And I really do think that we can credit that to a lot of the tools that I learned from the DNP program.
Thank you, Dr. Paul. That is such an excellent way to showcase how not only did you learn from working through the DNP degree, but how you took it and used it after for another project as you went through the exact steps that you learned when you were within the program. So that was a great example. Thank you very much for sharing this.
You're welcome.
Does anybody have anything they want to say? Okay, well, again, thank you very much, Dr. Paul. So Dr. Paul was one of our earlier graduates, and I'm going to move to later in the program now, and I'm going to ask Dr. E. Lois Edge if she would like to share her experiences with us. And please introduce yourself a little bit.
Okay, I'm E. Lois Edge, certified nurse midwife here in Albany, Georgia. That's Southwest Georgia. I'm one of the, Frontier means a lot to me. I'm back in class 15. I'm only 58 years old. And I'm just so happy to be here. This DNP program has made a great difference for me. I started in labor and delivery in 1978 as a registered nurse. Then I did step-by-step degrees, associate, then BSN, master's, on and on. and then I ended up at Frontier for my midwifery, and now blessed to have just finished June 17, 2016, the doctorate program. And so I say to everybody as we share with you, yes, you too, as a midwife, can complete a DNP program, even though you're actively working. I got off at 8 o'clock this morning, and I still got my hair straight. And I'm just so happy about everything. When I think about my DNP journey, I think about particularly the clinical aspect of it. I had worked from that 1978 point, particularly more starting doing the midwifery portion of my career. It sounds simple. It sounds easy. We know the benefits of it. Can you all hear me? I'm sorry.
Yeah.
Yes, we can.
Okay, my picture had went away. I'm sorry. But you know the benefits of it. But I had a major challenge. I get all my mothers ready to breastfeed. And then here come grandmama and the formula generation and just disturb all of that. So the DNP program was just essential. It gave me a new regeneration, I would say, in tackling an age-old problem where our initiation and duration rate fell way off the charts compared to Healthy People 2020 and just the nation. So this was a challenge for me. So the beautiful experience going through the DNP program, I could think most of all just being at DNP bound. That's when we start off, and hearing that concept about community of inquiry, and it has grown and it means something. At first, I could not conceptualize it, but now it really means something. Evidence-based, I went to, as a labor and delivery nurse manager, I would hear evidence-based care, and it was like, oh yeah, evidence-based, yeah, basic evidence, law and all, whatever. But it really is part of me now because it has grown. When you think about what we learn in our program and that step-by-step process of becoming part of that community of inquiry and thinking about evidence-based, and we learn the different levels, the important, that expert opinion, of course, at the low, and then you got the pinnacle, and then you can use this evidence to come up with strategies to address long-term problems. And that's why I'm excited. And my project is entitled A Multi-Strategy Plan to Improve Breastfeeding Initiation and Duration in a Vulnerable Population. So most of our patients, our ladies, our mothers, family, is 80% plus African American. And the mother, the voice of the grandmother is very strong in this population. And the DNP program took you where you had to look at the cultural aspects, et cetera, and learn how to tie that in and seek evidence to deal with the population. So that was just grand. And so I'm so excited about it. I was able to develop this plan. Dr. Tia Andrew-Getty was my chair, and Dr. Karen Wambach was my content expert. So it was just wonderful, and they would guide me, and we come up with what I think is a great plan that is ongoing at this time. This multi-strategy, a lot of the evidence showed that education was good. Yes, provider education, family education, partner education. Support was good, peer support, certified lactation counselors, etc. But the research, the evidence showed that a combination of methods including education and support was the pinnacle. So that's my project. And so I'm excited. I have involvement from physicians. October the 11th, the EPIC program will be coming in and educating our family. What I mean by that, that's the physicians, the midwives. Dr. Callens, one of the providers, she just jumped right in, and truly we have a collaborative effort. And she suggested that we bring in the pediatricians. So it took a little longer. I want to just get it done. Let's go. But we've gotten everybody together. So we needed a bigger room. So we have a conference room style. And so everyone will have a focused education on breastfeeding and improving the initiation and duration rates. I will have another opportunity to share my project. One of the things, the little tidbit I used to love in the DNP program after I figured it out, that, hey, they all going by these essentials here as far as what that we would do. The DNP essentials, and you would go step by step, and each instructor had to outline their methods of teaching and whatever you would do to cover. And so that was great. I almost know them by heart now, but it really just outlines and shows the importance of the DNP program. So I've gone from 1978, transitioned 1998 as a midwife, and now I'm truly, even in my later years, excited because of the DNP program from Frontier. Thank you.
Well, thank you, Dr. Ed. And we certainly enjoyed your journey. And I have to say, you had one of the renowned experts in the country working with you. Anybody who really looks at breastfeeding and studies breastfeeding knows that, Dr. Wambach is very instrumental, has written the book on breastfeeding. So I wish you well, and we'll be excited to hear as you continue with your endeavors to see what happens with your project outcomes. Thank you.
Thank you.
Okay, another graduate that is not too far in the past is Dr. Victoria Evans. Would you like to introduce yourself, Vicki?
Sure, thank you. Hi, I'm Vicki Evans, and I was in DNP cohort number 14. So I finished the DNP program in June of 2015, and I did it was a 15-month program still at that time. And it was, I had always been interested in the DNP program when it first evolved and came out, and I would look at it and think, well, maybe I'll do it, and went back and forth. And then I had one of those moments where I picked up the phone and I called Frontier, and Barbara Anderson got on the phone, and she just hooked me and reeled me right in and just kind of got me, gave me all the information I needed to be able to proceed forward, and I just did it, and I was very happy that I went through the program. I really enjoyed the program and felt as though it gave me a lot of tools that I thought I may already have possessed, but not to the extent that the DNP program provides for you. So I am going to talk a little bit about my capstone, because as I look at my capstone, I think it parallels in areas the evolution of progressing into a DNP graduate and what you bring with you during the education process as well as afterwards that I use clinically. My project was implementation of patient-administered nitrous oxide for pain relief at the hospital where I practice at Maine General Midwifery. I live up in Maine. So I had identified all the problem. I looked at the hospital and knew that there was a high epidural rate. Patients wanted a low risk option, and the closest place to get nitrous oxide was 3.5 hours away. So that wasn't an option for women. So I started to formulate my plan, and my first part of my plan was to implement nitrous oxide at Maine General. Now, if I hadn't been in the DNP program, that's where it would have stopped. I wouldn't have gone on any further. But being a DNP student, there was this push to really look at it with an emphasis on providing evidence-based practice and theory that would improve systems of care. So looking at that, I really had to broaden my plan. And I did. I added that I wanted it to be sustainable for a year. I wanted it to be a model for other hospitals in Maine. And so that became a broader focus and kind of gave me that insight into looking at the healthcare system versus what this one hospital needs. As I went along in the process, I had a plan of action. I reviewed the literature, and yes, that was one thing that I really found myself enjoying, was getting into the literature, and I never really had before. So that was a revelation to me. I would read articles and then say, that looks really interesting. I wonder what so-and-so says about that. And next thing I know, like 4 hours had gone, and I hadn't done what my assignment was, but I had read a lot of great articles. So I, did the review literature. One of the things in my needs assessment is I did an informal survey of the OB providers, and I also just started, there was nobody really who had done this, so there was no guideline for me to follow. So I just picked up the phone and I started cold calling people in the US that had nitrous oxide programs. I'm not sure I would have done that if I hadn't been in the DNP program. I mean, it was very well accepted by the people on the other end of the phone. They they were very interested. What was I doing? How was I approaching it? What were my thoughts on such and such? It was great, and I think the DNP really helped facilitate that I was doing that. I formulated a stakeholders group, and I also wrote a new service policy and procedure for the use of nitrous oxide, and I used a European model. I didn't use what was some of the hospitals here in the US had been using, where nitrous oxide is under the auspices of the anesthesiologist, but instead I did it where it's the midwives or the physicians are the ones that initiate it. And that was accepted in the hospital by all of the players: anesthesia, pediatrics, medicine, family practice. And one of the big reasons it was accepted is because I had presented research and scientific data, that there was no stone unturned, and that's exactly what the DNP program really prepares you for. I could answer anybody's question. And so we were able to have this policy and procedure, and I'm going to talk about that a little bit more, have that go forward. I continued on with a plan of action, and one of the things that I did in my plan of action is I made visits to other sites. And I thought that was kind of a good idea, but my faculty chair thought it was a great idea, and so did some of the other faculty. And so off I went, and I visited 2 hospitals in the US. I visited Brigham and Women's Hospital in Boston, Yale New Haven, St. Raphael's Hospital in New Haven, Connecticut. And then I decided that I would go up to Canada and see what they were doing, because I'm not that far away. It was a 6-hour drive. So I went up there. And one of the interesting things that happened with this, I really wanted to compare how were we in the US with nitrous oxide implementing it versus Canada, which has had it for a while. Well, I kind of joke about it, and it is kind of humorous, but they thought I was crazy going up there. They couldn't believe I drove all the way up there to see nitrous oxide. It's so common for them. It's like somebody coming down looking at wall suction for us. So they started bringing people in to meet me because I think they couldn't believe that's what I did. But it gave me a very valuable insight that I wouldn't have had if I hadn't made that trip and that journey and been encouraged to go up and do that. I was comparing all these hospitals, and what I was seeing in Canada was the European model, which I had read about but hadn't seen. So it was really wonderful that was pushed from the faculty. There were other parts of of my capstone. I did an educational module. I also did a comparison of other modes of pharmacologic pain methods compared to nitrous oxide once it was implemented. And one of the things that we did see, which was really exciting at the end, was that the use of nitrous oxide went from 6.25% used up to 32.5%, and that was in a span of 10 months. So it was very well received. One of the I went through this before the implementation. I did an educational workshop for everybody, and everyone had to take it and take a test afterwards. And one of a faculty from the Dartmouth Family Practice Residency Program sought me out and said, you know, I just want to say how happy I am that you're doing this and that you did such a thorough job with your evidence, with your research, and it was so evidence-based. She said so many times things get implemented that don't have that. And I have to say that was the DNP program that really was instilled in doing it. So I guess, you know, one of the things that I walk away with from the DNP program was my goals were met in my capstone project. It was sustained for a year. We're in year 2. It's been very successful. We are a model in Maine. People are calling me. I have 2 hospitals right to me, that have asked me to come and consult with them to try to get nitrous oxide up and going. And that policy and procedure that I wrote, the nurse manager gave it to everybody, every nurse manager in the state of Maine who is interested in starting nitrous oxide. So that's been really disseminated and been great with that. But the tools that I needed were provided in the curriculum. That was always there for me. And one of the I think the 2 big takeaways that I feel like I have gained after going through the DNP program and now practicing as a DNP graduate is I have a seat at the table. I have credibility. I don't have any problems getting my opinion heard. And it broadened my viewpoint, and it isn't quite as linear. And I didn't think I was linear, but I realized that there was some linear thinking, and it's much more global and broad. And I would strongly recommend going for a DNP. It was worth all the time and effort. Thank you.
Thank you, Dr. Evans. That was a great example. And, you know, as I said earlier, when I watch you all go through the program, it really is true. When you present at the end of the program and you present your work, you really can ask you just about any question, all of you, any question, and you have the answer. And it's because of the deep dig into the literature. And the fact that you jump outside your comfort zone and start traveling places and reaching out to people, that's great. That's really great. Thank you for sharing. Oh, they're so, isn't it exciting hearing all these midwife stories that they're going out and practice? And okay, Dr. Alicia Wilkes, can you tell us a little bit about your experience and introduce yourself to us, and then talk to us a little bit about your project?
Of course. Hello, everybody. So I am Dr. Alicia Wilkes. I am a full practice nurse midwife practicing in the community just outside of Seattle, Washington. So my goal in going through the DNP process was to come out on the other side able to be more of a leader in my community, to be seen as knowledgeable and educated in a way that would facilitate collaborative relationships and build my colleague base in a wider stance, so to speak. I didn't necessarily know that going into it, but I'm definitely, I don't think that in my situation, working as a community-based midwife especially, I don't think you can really understand the huge impact that having doctor before your name and, you know, the DNP after your name will have, as Dr. Evans was speaking to, you know, getting you a seat at the table and having your opinion listened to in a different way. So that has been really huge. I've had a large access that I probably would not have if I didn't have that DNP. And interestingly, when I went into the program, I had kind of an idea of what I wanted to focus on, which was to develop a model that I could implement over the years of an integrated health and birth center in the community. So when I went into my literature search, I discovered that there was nothing. So there's no evidence, no research available about services beyond the scope of standard maternity care that freestanding birth centers in the US were providing. So I had to kind of go back to the drawing board and ended up doing a survey of birth centers in the US, asking them about the services that they are providing. And what was really exciting, and where my suspicion was in the beginning, is that yes, many of them are definitely providing other services. So things like pediatric services, mental health, women's health, which is in most states is well within the CNM scope. But interestingly enough, they are also providing men's health, and not just co-STI testing, but things like annual exams and prostate exams. So that was really, really fascinating to kind of get into what that level of research is like. So I ended up with a lot of descriptive statistics and some really great preliminary data that if I have the time and money to, work on getting funding, I could really delve into and do some more work with. So I had the opportunity just this past weekend to present my research through the DNP capstone project at the AABC conference through a poster presentation, and got to connect with a lot of really interesting people, and had other researchers encouraging me to go farther into the data and to publish it in a journal. And I'm like, I'm just a little baby researcher. But fascinatingly enough for me, from my perspective, is that I was able to speak with them, as if we were colleagues. And that was really, found the DNP program was foundational in that for me, like being able to understand, what research is and to communicate with other researchers was huge. And I've had the opportunity to co-author a chapter for a textbook that's coming out in the spring on birth centers. So I really came out of this program an expert in an area that I didn't expect really to be an expert in, especially at this point in my career, because I've only been practicing as an independent midwife in my community for about 2 years now. So I have a lot of great relationships and a lot of really strong academic foundation that I am really able to, put into practice, and a lot of great ideas that I'm really excited about working on further. And the biggest piece for that, the biggest benefit that I see is all of the relationship building that has opened up for me through this DNP program. So I am 100% for doing the DNP, and I talk to people about it frequently, and really, really hope that practicing nurses will, advanced practicing nurses who are practicing clinically will understand that it's not just about having more work to do. It's not just about, having, more going out, but you really develop the sense of how important having the nursing perspective at the higher levels, not that it all has to be hierarchical, like levels of government, levels of practice, in the hospitals, outside of the hospitals. It's so important to get that nursing perspective, especially based in the midwifery model. And I'm so excited that the rest of you are out there doing that work. And I cannot wait to see more of us out in the field with, boots on the ground, so to speak. So thank you so much.
Thank you, Dr. Wilkes. And it is very true. Sometimes when you start getting into the literature, because of a perception of maybe what is needed, you find that there's really nothing out there, and it maybe takes you down another path. So that was a really good example of how that can happen. And definitely relationships can occur at this level. We've had quite a few students end up being part of larger programs from the relationships that they've formed while they were doing their DNP. Okay, so we have one more, and I'm going to call upon Dr. Elizabeth Nutter. And I can truly say with Dr. Nutter that not only have I had the pleasure of working with her in different aspects, but seeing her grow within the DNP program and become an expert in a field where there wasn't very many experts at all, and serving as an expert for some of our other DNP students. So Dr. Nutter, would you talk to us about yourself and about your experiences with the DNP?
Perfect. Thank you. So I'm Liz Nutter. I'm an active duty major in the United States Army. And I always knew that I wanted to pursue a doctoral degree, but I pushed back on the idea of going and getting a PhD. That didn't really seem like a good fit for me. And when I became a midwife, because I wanted to stay at the bedside and I wanted to implement change in my population. And when the DNP came about, I was like, oh, this is a perfect fit. And I'm proud to say I was the first midwife in the Army to have a DNP. And the Army imparts on us leadership is key. And so I had grown up with that foundation for, I went in at around 12 years of being in the military when I went in and got my DNP. And I knew that the Army was going to be having our new graduates, our new midwife graduates have the DNP degree. And it was really important to me as a leader within the organization that I had that option to go back to school. And I did it full time as a chief midwife. And so some long hours, but it was definitely worth it. And my area of expertise is in water birth. The Army had been doing water birth since 2004. And the OBGYN consultant to the Army Surgeon General contacted me and asked me to do a multi-center clinical trial looking at our data. So a retrospective review of all of our data. At the time, we were all doing different protocols. And while we had fantastic outcomes, I said, well, our data is really not going to mean anything until we standardize our approach. So I took my DNP as an opportunity to explore the evidence. And so I did a large dive of the literature and developed a protocol that was based upon the evidence. And I put together Department of Defense's water birth program. And it included the training for the nurses, the training for the providers. And it was all based upon the evidence. And the DNP, what it has allowed me to do is I was able to reach out to experts that are well published in the Cochrane database on water birth, like Ethel Burns, and people that, again, I would have never thought I would pick up the phone and have a conversation with them, but that doctoral student opens up many doors for you. So I had great opportunities to talk with some of the forefront experts in the UK on water birth through my DNP project. And then when I graduated, I was able to implement it at Department of Defense. I was the title behind my name and having that deep dive in the evidence where I was able to articulate the evidence so clearly, where water birth, we have some pushback sometimes, specifically from our pediatric colleagues. And I've had opportunities to go in and speak to pediatricians and change the room from they were completely as a team against it to seeing where the flaws are in the argument from the American Academy of Pediatrics side and really demonstrating through the research where the holes are. So that DNP offered me that opportunity to go in there and to have those hard conversations based upon evidence. It's offered me the opportunities to speak with CPMs. So I'm bridging the knowledge gap between CNMs and CPMs. So I've been invited to speak to CPM organizations. I've spoke at the American College of Nurse-Midwives. I've done a couple of podium presentations, a 4-hour workshop. I just had an opportunity to speak at an international conference, which was really wonderful because I got to see how our sister midwives in other countries are practicing. So I've had the opportunity to publish 2 peer-reviewed articles in the Journal of Midwifery and Women's Health. I've published 2 chapters in books on water birth. So the skills that I gained with evaluating evidence and being able to really succinctly write about it afforded me the opportunity to be able to publish as a really new DNP graduate. So that was fantastic. I love mentoring. That's one of my passions. And so I've had the opportunity to work with DNP students that call me up and they're like, I want you to mentor me. So that's been really important for me as part of, I feel my doctoral responsibility is mentoring and passing it on and mentoring midwives that want to take this skill into practice. The other thing too that I think is really important is while I'm really focused in water birth, I look at everything differently clinically now. Everything that I want to do, I find myself going to evidence and bleeding it over into my nurses and taking articles to the leadership and saying, you know, this is the latest and greatest, and, you know, this is what we should be doing, and let's change practice now. And I think it's really important that as DNPs, we're leading the way and we're taking what the PhDs have put out there for us and quickly implementing it into practice change. And so we don't have that huge, like, 12 to 15 year gap where it's sitting on the shelves and we're not moving it into clinical practice. So I think that's what the DNP has afforded me, is many, many opportunities to work one-on-one with nurses, and all the way up to, you know, Department of Defense policy that I've helped write. I've worked on the American College of Nurse-Midwives working group for hydrotherapy, and we use the foundation of my DNP project to write, which will shortly be released, a national protocol on what's the best evidence to support water birth. So really exciting stuff. And I really think I got all the tools from my DNP, and it would not have turned into the massive momentum that it's turned into without having those skills behind me, for sure. So I really encourage people to just take the leap of faith, and even though you think you're not going to have the time, you find the time. So in between all the births and being a chief midwife and having staff that I had to take care of and being a major in the U.S. Army, I found time to make it happen. So I know that you can find time to make it happen too. So thank you.
Thank you, Dr. Nutter. And I suspect that some of your military organizational skills were very helpful as you took on all those various pieces. So thank you, everybody. I'm always thrilled to hear the work and the ongoing work, because we don't always get to hear the ongoing work after you graduate. So it's been really exciting to just get a tiny little snippet of what is going on out there with all of our DNP graduates, and you're representing the midwifery community very well.
I would
Dr.
like to say that, yeah, I'm so proud of all of you, and your, you know, I always remember Mary Breckenridge's quote that we want the future to be more than we have ever been, and you all are doing that. This DNP has turned out better than we ever expected, and when I hear sessions like this, I'm just absolutely thrilled, and know that we're going to make this whole world a better place by the work that you're doing. So thank you so much, and thank you for sharing tonight. And it was very exciting.
Thank you.
Thank you.
Thank you.
Thanks.
Thanks again. And